Every parent waits for the first smile, the first giggle, the arms reaching up for a hug. But what if that moment doesn't come? What if your baby doesn't look at you, doesn't respond to their name, or seems lost in a world of their own? Today, we're talking about the earliest signs of autism and what every parent needs to know, because early intervention changes everything. For those who are new, I'm Dr. Larry Mitnaul, a double board certified child and adolescent psychiatrist. I'm also a father of 7, and I talk about connection in the age of screens. So welcome. So what is autism? Autism isn't just a social struggle, it's a brain difference. Most babies are wired for connection. They coo, they smile, they play peekaboo, they light up when you walk in the room. But some children, even by 6 months, don't follow that path. They don't make the eye contact, they don't babble or respond to games, they don't point or wave. Instead, they live in patterns, routines, repetition. And while every child develops at their own pace, certain delays and behaviors can point to something more serious, autism. So you might be asking, so what does autism look like in a young child? Well, here are some early red flags or signs that we might see that suggest a child should be evaluated. At 6 months, you may see no smiling or warm expressions. By 9 months, maybe no shared sounds or facial expressions. At 12 months, no babbling, pointing, or waving. At 16 months, maybe no single words yet. And by 24 months, there can be a loss of speech, babbling, or even some of the social skills you'd expect. You may also see kiddos who don't respond to their name, and maybe they start to avoid eye contact, or they're not showing toys or engaging in pretend play. You might also see kids preferring objects to people. Perhaps they repeat words or phrases, and the term we use for that is called echolalia. They might even use unusual language or referring to themselves in the third person. Behaviorally, too, there can be some signs that we notice, like rocking or flapping hands, obsessive order or routines. They can also become very distressed by really minor changes. So as you're beginning to appreciate, autism really has a wide spectrum. And here's the truth many people don't realize. Autism doesn't have one look. Some children are nonverbal, others speak in full sentences but struggle socially or emotionally. And some children with autism may excel in math and music or memory, while also struggling with transitions and friendships, but misunderstood as quirky or defiant or rude when they're overwhelmed. Autism can occur with and without intellectual disability, and its severity varies widely. That's why diagnosis requires more than just observation. It needs a thorough developmental and psychiatric evaluation. Now, in truth, we're still learning the causes of autism, and there is a lot of research to be done in this area. So what helps and when do we act? There's no cure for autism, but here's the key. Early interventions transform outcomes. Treatment should begin as soon as delays are noticed, not after a wait and see kind of period. And so effective treatments include some of the following. So speech and language therapy, behavioral therapy like ABA or CBT-based approaches. Occupational therapy can be among those modalities, and parent coaching too can be extremely helpful. These children may also benefit from specialized education programs, sometimes medications when needed for associated behaviors or symptoms. So the goal of psychiatric help is to understand the diagnosis, to build a treatment plan, and to be able to address the emotional and behavioral challenges that can present. As with most psychiatric disorders, really supporting the whole family's well-being is the treatment. Now, here's what I want you parents to hear. If you're worried your child isn't connecting, don't wait for it to click. Trust your instincts, because when you act early, you give your child access to the support, the tools, and the team they may need to thrive. Your child may not follow a typical path, but with the right supports, they can walk their own with confidence. If you're noticing any signs of delay or feel unsure about your child's development, talk to your pediatrician. Ask for a referral to a child psychiatrist or a developmental specialist. Be sure to check out the link in the description and the top comment note for resources that I'd like you to have. And remember, you're not alone, and your child deserves to be seen, known, and supported. Make sure you check out this next video about building your strongest attachment with your child. Take good care and be well.